Here we want to introduce a technique that using mini-patellar tunnels for transosseous strength and fixation of patellar graft with high-strength threads in MPFL reconstruction. All the authors have no conflicts of interests. Make a vertical incision of 2 cm along the medial part of upper half patella, systematically dissecting through the tissues layer by layer to expose the medial patella. Then a 2 mm Kirschner wire is used to obliquely drill outward in the exposed deep aspect of the proximal medial patella. A 12-gauge spinal needle loaded with high-strength suture is then employed to insert along the bone tunnel, emerging through the skin. Subsequently, a suture grasper is used to capture one end of the high-strength suture beneath the skin. A parallel methodology is applied to prepare the bone tunnel in the superficial portion of the proximal patella, with the variation being the use of a spinal needle loaded with PDS suture. After retrieval with a suture grasper beneath the skin, the loop of the PDS suture is utilized to pull one end of the high-strength suture through the superficial opening of the bone tunnel, thereby completing the suture fixation structure for the proximal patella. The subsequent step involves the preparation of 2 another mini bone tunnels near the distal end of the upper half patella, located close to the middle of the inner edge. The center of the 4 mini tunnels is the middle and upper third position. The method mirrors the procedure described above. Another high-strength suture is utilized for percutaneous passing through the 2 mini bone tunnels drilled by 2 mm Kirschner wire. The suture passing process is also used with the grasper, the spinal needle, and the PDS suture loop. Then we complete the suture fixation structure for the distal end of the upper half patella. This is the final view of the transosseous suture fixation structure prepared for patellar graft fixation. The retrieved autogenous gracilis muscle tendon ends is braided sutured. Subsequently, bring the gracilis muscle in close proximity to the patella, using the midpoint of the gracilis muscle as a reference point. Suture one end of each high-strength suture to the tendon continuously for 3 stitches. Then, tension the other end of the high-strength suture to ensure close apposition of the midpoint of the tendon to the patellar bone surface. Finally, tie knots individually to secure the tendon in place. The next step is soft tissue resuture fixation. All the 4 ends of the high-strength sutures are sutured with the fascia on the surface of the patella and tied again. Then we finish the patellar graft transosseous suture fixation and soft tissue resuture fixation without implants.